Welcome to the BSc in Oral Health Sciences Open Day. My name is Maxine Lee. I'm the programme lead for the BSc in Oral Health Sciences in the Dental School in Dundee. So what we're going to do today is just go through a PowerPoint presentation that will tell you a little bit about what it's like to study the BSc in Dundee. And it will give you an idea of how you can apply should you wish to as well. So first of all, let's think a little bit about Dundee and why you might want to come to Dundee to study. Not all of you will have been to Dundee before, and it's really unfortunate that at the moment we're doing this open day online and you can't be in Dundee to have a look around campus at the moment, but hopefully you will soon. We want to let you know what a fantastic place Dundee is to study in. It was founded in 1967 and at the moment we're one of the UK's top 20 universities. Dundee City is a fantastic place in itself, but to be a student in Dundee, it really is geared towards the student fraternity, and everyone in Dundee around campus is very aware that you know, there's lots of students in the area, and therefore you'll find that people are really helpful for new students around campus around September time, and hopefully should you gain a place at Dundee, you will get a chance to come and visit campus and see just how the Dundee city centre is geared towards the student population. And the good thing about Dundee as a student is that all the areas around campus are close together, so you don't really feel like you have to travel very much at all. We've got a slide that shows you the campus itself, a sort of aerial view here, and this shows you all university buildings. And what you can see is that you've got the library right in the middle of the campus, and so is the dental school. And the halls of residence around the campus are very, very close to the dental school as well. So the good thing is that you don't really have that far to travel into school, or if you've got perhaps a break between tutorials or lectures, or you've got a break between clinics for lunch, you can either go to the library, you can go back to halls for lunch. It's a really nice place to be a student from the point of view of being able to access everything you might want to in your day. So we've got about 12,500 students on campus, and each first year student is eligible for a place in halls of residence should you wish to. Dundee ranks very highly in student satisfaction. We're number 4 in the UK overall for student satisfaction. We are number 2 in the UK for satisfaction with living overall, and that is testament to Dundee being so student oriented. So moving on to dentistry and the dental school, we are currently 2nd in the UK for dentistry. We're never far from the top spot, but at the moment we're 2nd in the UK for dentistry, and we're very, very proud of that. The dental hospital itself, you can see in the top picture on the slide there. It's a very, very tall building. We've got clinics over 5 floors, and the other floors are offices. It's an extremely friendly dental school. The staff and students all pretty much know each other very well. It's not the largest dental school in the country, but we pride ourselves on the sense of community that we have because of that. You're never far from a friendly face and someone that you know that can support you should you need it. A lot of staff in the dental school are ex-students, and that's testament to the fact that they have had such a fantastic time as a student and wanted to come back to the dental school to teach, and I'm one of those. In the bottom picture there, you can see the facilities that we have for practicing dentistry on phantom teeth, phantom heads, and we use plastic teeth for that. So this is our phantom headroom, or our clinical skills laboratory, where we have intraoral cameras. We have all the dental instruments that you would be expected to use on real live patients. But what you get to do in first, second and third year of the BSc in Oral Health Sciences is to go into the phantom headroom and practice the procedures that we're teaching you at that time on the dummy heads first, before we let you loose onto real patients. So the BSc in Oral Health Sciences is a 3-year degree. It's an ordinary degree. And what that means is there are no honours associated with it. And when you graduate with a BSc in Oral Health Sciences, you will be qualified as a dental hygienist and a dental therapist. So you will go on the General Dental Council's register as both a hygienist and therapist, and you can practice as both. So let me first of all go over what you are permitted to do, the remit of a dental hygienist and the remit of a dental therapist, so you know what you're signing up for. A dental hygienist is more to do with periodontal problems and prevention of periodontal problems and prevention of dental decay. Patients who have gum disease go to see a dental hygienist to have their gum disease treated. And for that, you need to be able to do intra and extra oral assessments. You are able to apply materials to the teeth like fluoride to prevent decay and fissure sealants. Some of you might have these. These prevent decay in the posterior molar teeth. You are trained to take dental radiographs that you can see at the bottom of the slide there. It's very important that you're able to take radiographs as a hygienist and therapist, because we can diagnose disease from these radiographs. Both gum disease and dental decay can be seen on these radiographs. And to be able to treat the diseases, you need to be able to numb your patients. Therefore, you're able to give injections of analgesia so that you can numb the teeth that you're working on. You're also able to take dental impressions, so you can make molds of the patient's teeth. And one of the huge roles of a dental hygienist is to provide dental health education, either to a patient on a one-to-one basis or in group settings. So there's a huge preventive role to the dental hygienist, so preventing gum disease and preventing dental decay. But should a patient have gum disease or periodontal disease that we can see in these slides here, just above the radiographs, you are able to treat it by scaling above and below the gum line to treat the periodontal disease. Moving on to dental therapy. As a dental therapist, you're able to do all restorations in primary teeth and permanent teeth, so in children's baby teeth and adult teeth, and you're allowed to do all the restorations that a dentist would do. The only type of restorations that you're not able to do, that a dentist can do, are the indirect restorations like crowns, veneers, and inlays that need fabricated in a laboratory. So any direct restoration that is placed in the surgery at the time of the removal of the decay, a dental therapist can do these. A new way that we treat dental decay in primary teeth or baby teeth is by placing preformed stainless steel crowns on the tooth. So if you look at the middle slide on the right hand side there, you can see before and after, where we've got a very large open cavity with decay on that molar. These baby teeth don't take well to us going in there with a dental drill and removing the decay. That's exactly what we would do if that was a permanent tooth. Baby teeth don't like it very much. The nerve is very close to the surface, and there's a chance that if we were to go in there with a dental drill to try and remove that brown decay there, that you would end up exposing the nerve of the tooth, which would mean that the tooth would become non-vital or no longer alive. You want to preserve the vitality of the tooth, and the way that we've discovered we can do this now is by sealing in the decay, not removing the decay, but sealing in the decay by placing one of these stainless steel crowns over the tooth. And we do that far more now on children's baby teeth rather than going in with a dental drill and removing the decay. And the theory is that once you've got that stainless steel crown over the decay, you are isolating the bacteria within the decay away from the sugar in the diet, and the decay should stop, it should arrest, and the tooth will become loose and come out just as it normally would at the right time when it's time for the permanent tooth to come through underneath it. So what we're trying to do is preserve the tooth for as long as we can until it's naturally time for the tooth to exfoliate. So that's something else you can do as a dental therapist. Now, if you get to the stage where the decay has gone into the nerve of the tooth and there's nothing you can do about that other than take the tooth out or do pulp therapy. You're able to do both of those. You're able to extract primary teeth and you're able to do pulp therapy in primary teeth. Now, pulp therapy is in the picture at the top of the slide there. What we do there is we do a type of a root canal treatment on a baby tooth where you remove the diseased part of the nerve of the tooth and fill where the nerve chamber is and where the nerve used to sit with a special material, and then we would most likely place one of these stainless steel crowns over the top to protect it in the hope that we can preserve the tooth. Now, you might think, why don't you just take them out? These teeth are going to come out anyway. It's very, very important to maintain the baby teeth and preserve the baby teeth for as long as we can, because they are very good at guiding the permanent teeth into position, and you can end up with real orthodontic positioning problems with the permanent teeth if we've had premature extraction of the baby teeth. So that's why we try and save the baby teeth as much as we can. Inevitably, there will be times when you are unable to save the tooth and extraction is the only solution, and that's something that you'll be trained to do as a dental therapist as well. What might you want to do once you've graduated as a dental hygienist and therapist? Well, I'm glad to say that all of our graduates are in work or in further study within 6 months after graduation, and there are quite a few pathways that are open to therapy graduates. You might want to go into general practice, where you get lots of experience with your full remit in NHS and private or independent practices. You might want to go into specialist practice. There are a lot more specialist practices now than ever. You get quite a few specialist periodontal practices, so practices that specialise in treating gum disease that are desperate for hygienist therapists to work there, because they've got, that's the main part of their work. You also get lots of implant practices as well now, that regularly advertise for hygienist therapists to help their patients with the preventive side of maintaining their implants. You might want to go into the public dental service. Now, the public dental service used to be called the community dental service. So those of you who have been to a community dentist might know what that is. Essentially, the community dentist is more for patients who require special treatment. So it might be that perhaps you have a patient who's anxious, or you have a patient who has a complex medical condition, or you have a patient who has the need for more time over treatment. You might have a patient who has learning difficulties, and these particular patients, although they're not difficult to treat, they take more time, they take more specialist knowledge of the operator, and therefore these services employ staff therapists to go work with the dental service, the public dental service, to treat these patients, and it's a really, really rewarding service to join. You're given much more time over your treatments, and you know, it's a really good position to be in. You get huge amounts of experience on anxious patients in the public dental service. You might want to join the hospital service or come and work at Dundee University in the dental school. We do have staff therapists who work in the dental school. The staff therapists treat patients who are referred by the consultants. These patients are referred to the consultants by general dental practice. When they have discovered that a patient's treatment is out with their ability to treat, so they want someone who is a specialist to treat the patient. So these patients are referred for secondary care, we call that. So you might want to be a staff therapist in the dental school. We've got staff therapists in each department. So we've got staff therapists that work with children, with the orthodontic department, with the restorative department, and with the periodontal department. So all aspects of the remit of a staff therapist is used within the hospital. You might want to come back to the dental school to become a tutor to help train future dental therapists once you've got some experience. A lot of our graduates apply for these posts. And that's a very rewarding post as well. And you might want to go into the higher levels of the dental school and be involved in education and research, which is also really rewarding. The armed services and industry both have job availability for dental therapists. They both would advertise as looking for dental therapists to help treat their employees as part of their employee health scheme. So that's just some of the options that you might want to think about should you graduate as a dental therapist. Now let's have a wee look at the course itself. So the programme itself is a 3-year programme, as I said. It's split into 6 modules, so each year has 2 modules. So when you begin in module 1, we have to lay the foundations of all the knowledge that you need to begin starting patients. We start you treating patients very, very early in the BSc in Oral Health Sciences, and that is because you've only got 3 years to learn the skills that you require and get all the experience you require. So when you start in September, we take from September to December to lay the foundations of the law surrounding dentistry, ethics, the health and safety in dentistry, any medical emergencies that you need to know about for your patients, the anatomy of the head and neck, physiology and embryology and tooth development and oral biology. And these are all very light touch at that level because we are just getting you to a level where you would be safe to begin treating patients. So that's the kind of theory side in module 1. Alongside the theory, you go down to the clinical skills laboratory, and that's what you can see in the photograph there, and you would work on these phantom heads. Now these classes in module 1 are training you to scale teeth and treat periodontal disease using scaling instruments. So you are removing hard deposits from the teeth in patients who have periodontal disease or gum disease. And we simulate the hard deposits on the teeth by dipping plastic teeth models that are set up with plastic teeth, and we dip these models in hard setting plaster, and the students have to scale off the plaster. And what that does is it builds up the muscles in your hand. And then once we've done that, we paint the teeth with black enamel paint, and the students scale off the paint. The paint's much easier to remove than the plaster. We're not too cruel. We do give you lots of rest when you're in these classes because your hands get a little bit achy, but it's worth it. And when you get onto patients in January, you're well equipped to be able to scale teeth and do a very good job and be safe with your real patients. So that's the Phantom Head course in module 1. That ends in a gateway exam, so that we know that you're ready to be safe on patients. So you must pass the gateway exam where around about December time, where we assess your safety on using these instruments on a phantom head. When you come back after Christmas, you go straight to patient clinics. It's where you are able to treat patients who require treatment for gum disease. And alongside that, we start to teach you about the theory of periodontal disease, gum disease, the theory of dental caries or dental decay. We teach you about the microbiology of these diseases, so what bacteria are involved in these diseases, and pathology, what happens in the disease process. So it's a very, very busy year. It goes very, very fast, and before you know it, you're on to patients in January. It's very exciting. The students absolutely love the fast pace of being on clinics very, very quickly with the patients. And that's what you've signed up to do. When you move into second year, so that's modules 3 and 4, you go back to the clinical skills lab again. And that's because we're going to start you with treating dental decay. And we're going to teach you how to do fillings. We do that on phantom head again with plastic teeth, and the plastic teeth has sort of fake decay in them, and it's all about getting you safe with using the dental drills and being able to use the dental materials properly and restore teeth to a high standard. So that's the phantom head course in module 3. Alongside that, you're still learning about the process of dental decay, so that's cariology. You're learning about the materials that you use to fill the teeth, so that's dental biomaterials. You're learning about human disease. Now, when you were in first year, you would learn about the human body and physiology and how the human body works in health. In year 2, when you go into human disease lectures, you're learning about what happens when things go wrong with these body systems. And it's very important that you understand these medical conditions, because you have to understand what's wrong with your patient to be able to understand the manifestations that some diseases have in the mouth, but also to understand whether it's safe to treat your patient or not. Also in year 2, you learn to take dental radiographs or x-rays, and that's the imaging module. We do a behavioural sciences module where we teach you to communicate really well with your patients and teach your patients to, or motivate your patients to undergo behavioural change when it comes to stopping smoking or reducing alcohol intake or changing the way that they keep their mouth clean. And you also learn how to give local analgesia injections as well. So in year 2, very beginning of year 2, you do your local analgesia course, and that's where you learn to do injections on, you don't do injections on each other actually, we take you up to the anatomy department where you give injections on cadavers. And these are bodies that have donated the body to science. These people that have donated their bodies to science when they've died. And it gives you a fantastic opportunity to give a real injection and feel how it feels in a real person. We used to try to simulate what it was like to give an injection in different ways. We used to use pigs' heads. We used to give injections into tangerines, but there's nothing that we can really do as well as when we do it on a real person. You can't simulate it in any better way. So you will have been to the anatomy department in first year when you did your anatomy and physiology. So by second year, you will be used to being within the anatomy department, within the dissection lab and working on the cadavers. So that's first year and second year, you will be exposed to the anatomy department and working with these cadavers. So that's something that you need to think about, and whether you would be okay with that if you want to apply to the course. It's a fantastic opportunity, and it really, really helps with your learning. So after Christmas in module 4, again, you've passed your gateway exam at the end of the phantom head course on doing fillings. Therefore, you're able to start restoration of permanent teeth. Now, we go into clinics to do fillings with adults first of all. We don't allow you to do children's dentistry until year 3. And the reason for that is simply that it's much, much easier to be a new clinician treating an adult than it is to be a new clinician treating a child who might not be as cooperative as an adult. Now, don't get me wrong, you get some adults who are fairly uncooperative and who have their anxieties and difficulties with treatment, but we wouldn't be sending those patients to your clinic. We have a very good waiting list of patients who have been attending the student clinics for years, and they're all fairly good patients who are very cooperative, and we start you with these particular patients who make it easy for you. Once you've got lots of experience treating adults, when you go into modules 5 and 6, we train you to do paediatric dentistry and allow you to treat children. Now, one thing I should have said earlier was that years 1 and 2, you have lots of integration with the dental students for your teaching. So certainly in year 1, a lot of your teaching, in fact, all of your teaching is with the dental students. So everything you learn, every lecture you're in, every tutorial you're in, you are fully integrated with the dental students. The dental students are studying dentistry to become dentists. In second year, at the moment, again, our students are very integrated with the dental students, and they have additional things that they do that the second year dental students don't do, because the BSc in Oral Health Sciences programme is a faster programme. We have to accelerate our students clinically, because the dental students have 5 years to get the experience they require, whereas the therapy students only have 3. So what we're thinking is that by the time your cohort begins, we may have less integration in second year, because we're finding that second year at the moment is a little bit too busy for our therapy students doing everything that the dental students do, plus the extra bits that we have to give them. So certainly if you were to apply to BSc in Oral Health Sciences for next entry, you would definitely be integrated with the dental students for year 1 fully, and you do all the assessments that they do. Second year, you will definitely have integration. It might be slightly less than it is right now. And then third year, you're completely bespoke to the BSc programme. We take you away from integration with the dental students in year 3, because we're getting you ready for graduation. It's your final year. And this is where we teach you to do paediatric dentistry. So back to the clinical skills room for training on how to do fillings on baby teeth, how to do extractions of baby teeth, how to do the pulp therapy that I was talking about earlier, and place these stainless steel crowns as well. So that's from September to December, with a gateway exam again before you go on to children's dentistry clinics in January. Alongside the clinical skills in module 5, you will do a law and professionalism module, dental public health training, and some management and leadership training as well to get you ready for graduation. Not only are you doing paediatric dentistry though in final year is really clinical. So alongside paediatric dentistry, we've got adult restorative clinics. So you're doing adult restorative work in third year. You're continuing with your periodontal clinics. So you're still treating patients for periodontal disease. But we also send you to outreach clinics in third year. So not only are you doing lots of clinics within the dental school, but we let you spread your wings a little bit, and we send you to clinics within the public dental service. And these clinics still have supervisors, so you're still supervised, but you will get a little bit more of an idea of what it's like to be out on your own once you've graduated, and you'll see a little bit of a different aspect to dentistry out there, and it just gets you ready for going out. But yes, you're very much still supervised until you have qualified. So we've got a new curriculum in the dental school. It's called the 4D curriculum, and the 4Ds are essentially dentistry at Dundee. driven by discovery. We called it the 4D curriculum because we want to move away from traditional lecture-based teaching. I know that there are subjects that can only be taught by a lecture. There are subjects that you can't make interactive. There are some subjects that you essentially need someone to stand and present to you. And we do still have those within the curriculum. However, where possible, we need to try and get the students more engaged. Therefore, we deliver iClasses. Now, iClasses are basically just more interactive, where we will have someone delivering the class. And yes, there will be an element of teaching going on, but then we will split you into groups to do tasks, and then those groups will come back and present their findings. It's essentially about encouraging students to find out for themselves what they need to learn and learning it, rather than a lecturer standing transmitting all the information to the students as it used to happen, and students copiously writing notes all the time trying to get everything down. So you have a blend of iClasses, seminars, team-based learning sessions. Of course, you'll have practical sessions, and of course, you'll go to clinical skills, as I've said, in patient clinics. Don't worry, you will still get handouts. You know, if you didn't pick up everything from the iClass, you would get a handout of a PowerPoint presentation or whatever to supplement the iClass. And a lot of these presentations and iClasses are recorded, so you can get access to the recording as well. But our initial finding from the new curriculum is that the students are far more engaged in these classes and really enjoy it. So yeah, all of these interactive sessions are supplemented by PowerPoints and recorded lectures and things like that, so not to worry that you're not going to get everything down when you're expected to interact. We have to assess you. We try and assess now as much as we can by online exams. Most of our written assessments now actually have gone online, but we try and also assess throughout the module with coursework rather than having big exams at the end of modules. And as I've said before, you're going to have clinical assessments like these gateways that I was talking about, and you will definitely have a portfolio assessment for each module as well. So a blend of all these different assessment tools, essentially meaning that you don't have huge exams at the end of modules like we used to have, which is always really good for the students. That was never very nice. What about support in the dental school? Well, each student has an advisor for their year of study. And as a therapy student, you will have a year 1, 2 and 3 advisor. So you'll get a different advisor each year, but you will know us all very well. And you know, you'll go from one advisor to the other as you go up through the years. Should there be a situation where you require a bit more support than the therapy tutors are able to give you, we do have a senior advisor in the school. Dr. Andrew Mason is the senior advisor at the moment. Therefore, we can refer and work with Dr. Mason should we require to. If you need academic support, then what you can see in the picture there is the Inquiry Centre. Now that's at Campus Green. They have all the different departments of support that a student might require. You just go in there and you ask for whatever you need support with, and they will be able to direct you to the right place or give you a contact. So the support at Dundee University is second to none. We've also got a support administrator within the school, Sue Parsons, her job is student welfare. So you can always pop to the office and see Sue. Hopefully by the time that you would start, we're all going to be back fully in the building, and you can actually pop to someone's door, knock on their door and get some information. We haven't been able to do that for quite a while, but now we're all getting back into the building, and it's really, really nice to be able to do that, especially when you're looking for support. So how do you gain admission to the BSc in Oral Health Sciences? Well, you apply through UCAS. The deadline is the 26th of January. Now, entry requirements, if you have hires, what we're looking for is an A and 3 Bs at hire. Those who have a dental nursing qualification, those are reduced to 3 Bs at hire. If it's A levels that you have, we're looking for 3 Bs at A level. If you have a dental nursing qualification, that is reduced to 3 Cs at A level. Now, these must include higher or A level biology, and it must also include, you must have chemistry at standard grade 3 or NAT 5 or into C, and GCSE at C. You'll need to have studied in the last 3 years, and you must have studied an acceptable biology qualification within the last 5 years. There's no UCAT test for the BSc in oral health sciences, so that's where it differs from dentistry there. We don't expect you to do the UCAT for the therapy programme. How do we select for interview? Well, we just score your academic ability, all right? So we look at your exam grades and we score them, and you're ranked in order, and we select for interview that way. We tend to do about 30-40 interviews a year. Your personal statement is very important. It will not get you an interview because we don't appraise the personal statement for interview selection. We only look at the personal statement once you get to interview. So should you get an interview, that's when we will talk to you about your personal statement and appraise the personal statement. Okay. We normally take 10 students per year. Because of COVID, this particular year we're not taking an intake. We have got students who didn't move on in the programme from last year because of the effect that COVID had on the clinical experience. Therefore, we've had to hold on to students who would have moved up into the next year of the programme or on to graduation. Therefore, we're not taking an intake this year, and that's meant that we will be taking fewer students in this cycle of admissions. So I can't confirm how many places we will have in this cycle of admissions, but what I can say is that there will be a lot of competition for places within dentistry in general. And dentistry is exactly the same. Oral health sciences and dentistry will be taking fewer students this year in this cycle, and that obviously has an impact on the amount of competition. Work experience in dentistry, well, we fully acknowledge that it is absolutely impossible at the moment to get into a dental practice to shadow or observe. We don't expect you to do that now, and we haven't expected you to do that for a while. What we do expect, though, is that you should speak to someone who knows about dentistry. So try and speak to a dentist, try and speak to a hygienist or therapist, and find out what the job is like, find out what the job entails. And essentially what you're trying to do is reassure yourself that you feel that this profession is for you. So we're not expecting you to go and gain work experience at all, but we do expect you to have made inquiries and be sure to have asked some questions to make sure that that's a career for you. We used to do multiple mini interviews in the dental school where you have 10 different stations where you're tested on different parts of ability, so communication, how do you work in a team, your morals and ethics. We will talk to you about what do you know about a dental therapist and that kind of thing. The mini interviews have now gone online. And there's a high chance that in January, February, they will still be online. And what we do when we put them online is we choose 3 of the stations that we would have had 10 before, and they will still assess communication, your ability to work in a team, your sort of, are you empathic, are you caring, your ethics, and we will definitely ask you what you know about the role of a dental therapist to make sure that we know that you know what you're signing up for. And if you're successful in gaining a place, then you must undergo health checks, vaccinations, and we have to do a criminal record search as well. And these are requirements from the GDC, the General Dental Council, who's our regulatory body. I've spoken a little bit already about the 4D curriculum, the new curriculum within the dental school. Essentially, we want to make sure that our students develop as lifelong learners. You don't begin dental school in year 1, leave at the end of year 3 and stop. We want to develop you as someone who is inquisitive, someone who wants to look for evidence around things that are new, and wants to continue with the professional development. And that is what the GDC requires of us as professionals in dentistry. So we want to start you from year 1, and that's the ethos of the 4D curriculum. We want to produce graduates who will always put the interests of patients first. We want you to be caring. We want you to know the background knowledge of all the diseases that you're treating and keep up with your continuing professional development. We want you to have excellent clinical skills. We want you to be safe. We want you to reflect on your practice. And by doing that as students, we're setting you up to be excellent clinicians in the profession. So that's the theory behind the new curriculum. So what do? We give you just-in-time learning. What that means is the way that we've structured the course, we drip feed you what you need at the time. So we start with periodontal or gum disease and we get you onto those clinics. Then we do fillings, then we get you onto clinics. Then we do pediatrics dentistry and then you go on to clinics. And at each part of the programme, you're building on the foundation of knowledge from the year before. In team-based learning, or TBL, we've got here, there's a case journey, and it's a case that was almost like a soap opera of a dental practice. And just to make it a little bit more interesting, it's almost like a soap opera that develops, and the story develops of the dental practice and different things that happen to people within the dental practice, different scenarios that happen within the surgeries and the dental practice to aid your learning. And I think the students really enjoy that. As I said earlier, we've got a reduced emphasis on lectures. We have interactive classes, these iClasses. We split you into small groups to work very regularly, make sure you've got enough time to do the work that you need to do in these small groups. And we try and engage with the students as much as possible, rather than lecture to the students. And of course, you're going to have lots of clinical activities and practical work. Should you wish to look up further information on dental therapy, if you look up the British Association of Dental Therapists website, you'll get lots of information there, as you will from the British Society of Dental Hygienists and Therapists. And if you want to know about registering as a dental therapist, you will also find information on the GDC website as well. So the websites are all there for you. So that's us today. This is my email address, maxine.lee@nhs.scot. If you have any queries at all about anything that you've heard today, there's a Q&A going on just now. You can post your question or you can email me. If it's a more general question about admissions, then contact us at dundee.ac.uk is the email address that you're going to want to contact. Thanks so much for listening.